The second dimension, failing to develop on schedule, will appear about 2 to 3 years after the first. And this is known as the attention deficit, but it isn't. Here again, we have a misnomer. There are at least 6 or 7 kinds of attention and supporting networks in the human brain. They are not all disrupted by this disorder. What we want to know is which one. To help us with differential diagnosis, to help us tell ADHD from an anxiety disorder and from autism, and all the other psychiatric disorders, which all interfere with attention at some point in life, ADHD is not the only attention deficit. We need to be more precise. If someone comes to us and says, my child or I am inattentive, that is useless diagnostically. What I need to know is the nature of the inattentiveness. And we have now known for a decade that the inattentiveness that we see in ADHD is distinct from that produced by all other disorders, because it is most, I think, accurately described as a failure of persistence. The first attention problem is persistence toward a goal. Notice that this implies behavior, motivation, and the future. That is very important. The other forms of attention do not. ADHD is not a problem of perception, of filtering, of processing, of how the posterior part of our brain functions. It is a problem with the motor part of the brain, this frontal lobe. Can you sustain action toward a goal adequately to attain it? That implies a motivation deficit, and that is true, and it implies future-directed behavior, and that is true. ADHD is a failure to direct behavior forward in time. We cannot persist toward these delayed endpoints in life, the tasks, the goals, the things that need to get done. So persistence is deficit 1 in the area of attention. Now, to persist toward a goal, you must be able to resist distractions. But that, too, is not a perceptual issue. It is a motor issue. The person with ADHD does not have problems with perceiving distractors better than others. It is that they respond to distractors more than others. And that is an inhibitory failure, not a perceptual difference. You and I may all hear the noise in the kitchen. The person with ADHD is compelled to react to it. Oh, did you hear that? I guess they're washing dishes. Maybe I'll stop in and take a look. Did you know I was a dishwasher when I was back in college? That's how I earn my way. Do you see what's going on here? You all heard the dish, but it was irrelevant to what we're here to do today. But to the ADHD individual, the distraction is going to provoke a response, and the response can't be inhibited. And now they're off to the races, skipping from one thing to another to another. Now, there is a third aspect here that is impaired, but it is not one of attention. Most people, when they are distracted, re-engage the incompleted goal. The person with ADHD is far less likely to do so, and this has nothing to do with attention. This is working memory. So I would want a family to understand that there's more here than inattentiveness. There is a working memory disorder, and I would want them to know that working memory is one of the 5 special executive functions of the human brain, suggesting that ADHD is EFDD, executive function deficit disorder. Because working memory is where we remember what we're doing. It is remembering so as to do. It is consciously, effortfully holding in mind the what, the when of what we are doing. It's what you lose at my age and when you hit menopause. You do not lose memory. You lose working memory. You forget what you were doing, where you were going, what the goal was, the steps to the goal, how you were getting there. It is that that allows you to re-engage the incompleted goal, because you are holding in mind the goal. It is that which ADHD children and adults will lose. The goal is gone. It is forgotten. And now anything else compelling around them will capture their behavior. Hence, the symptom skips from one incompleted activity to another. The ability to re-engage a goal is a working memory disorder. And that's what they cannot do. And this begins to open the door on the possibility that the other 4 executive functions are impaired as well. More on that later. So let's understand that there are 3 interacting attentional problems. but that they are best thought of as executive deficits, not attention deficits. And they are the problem with persistence toward the future, resistance of distractions along the way, and working memory. And now you understand the nature of this attention problem from the one that's produced by anxiety and depression and autism and all the other disorders, including the learning disabilities, which have nothing to do with these. I would want families to understand that there is more to ADHD than just the inhibition and these attention and working memory problems. That at its heart, in its soul, it is a disorder of self-regulation, not one of attention. I think the biggest problem we have had as a group in convincing the general public about the seriousness of our children's disorder versus autism or schizophrenia or the other disorders is the very name itself is trivial. ADHD. Just go to Starbucks. Good God. Have some caffeine. We got more serious fish to fry here in psychiatry than the fact that you just can't pay attention, right? Part of the reason that our disorder, that the name of this disorder, is so often pilloried in the media is because I think we misnamed it. Right? This is a developmental disorder of self-regulation, not of attention. And that is a serious disorder, as serious as manic depression, and in its own way, as autism. But it doesn't convey that to people if they understand it only as ADHD, as opposed to SRDD, a self-regulatory developmental disorder. So I would want families to understand the seriousness of this, that this isn't simply inattention. There are some profoundly unique human traits that are not emerging as they should in this individual. And if you'll understand that, you'll understand the bigger picture, the why of everything. If it's just an attention problem, why am I seeing impairment in virtually every domain in which this child is asked to function? That would not come from just inattentiveness, but it would come from an executive function disorder, a self-regulatory disorder. So I would want parents to understand that this is the essence of this disorder, self-regulation. What is that? It is, first of all, the ability to consciously, willfully choose to inhibit your behavior and then to engage in a series of self-directed actions. That is, after all, what self-control is. You start to do things to yourself. These are responses that are not directed at the world around you. They're directed at you, right? You're trying to change your behavior in some fundamental way. The second part of self-control that your child struggles is not just the stopping, but the thinking. The thinking is the self-directed activity, the stuff I am doing to myself. Why would I do these things to myself? To change my behavior from what it would otherwise be. And why would I do that? To change my future. Self-regulation is not just for short-term self-improvement. It's for long-term self-improvement. It's to see to your own welfare over the long term. Should you act this way, given the sustained or delayed consequences that lie ahead for you? That is what you must stop and think about, and that is what they don't stop and think about, the delayed consequences. So your child is not just inattentive. They cannot stop and engage in a series of self-directed actions that they will now use to modify and moderate their behavior so as to bring it in line with their long-term welfare, the future. And that's what your child is struggling so mightily with in their development. It's what the other kids are acquiring and your child is so far behind in.